Hi, good afternoon. Thank you everyone for joining us for our Living with Kidney Disease and Transplantation program. The mission of the National Kidney Foundation of Illinois is to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. I'd also like to take a moment to thank all of our sponsors who are making this program possible: DaVita Kidney Care, Fresenius Kidney Care, Gift of Hope Organ and Tissue Donor Network, Northwestern University Medicine, and UI Health. Throughout the program today, please ask any questions that you have. You'll see a chat button at the bottom of your screen, so go ahead and hit that button and type in your question. And throughout this whole lecture series, throughout the first 3 weeks in November, we have a series of pre-recorded mini sessions. So these are 3 to 5 minute sessions that you can find on our NKFI Facebook, and you're welcome to watch at any time, as well as a series of lecture and panel discussions, which are a little bit longer, about 45 to 60-minute discussions, as well as your chance to ask any questions and get any questions answered. And for the lecture and panel discussions, anytime you come and join us live in person or live online in person, you are eligible for another raffle ticket for our raffle at the end of the program. And lastly, we also ask if you have a chance to complete our survey. We'll be mailing a link or emailing a link at every Friday. If you can just take about 5 minutes to complete the survey, it will really help us decide or direct how we host the program going forward. We're also looking for a new name for the program. So Living with Kidney Disease and Transplantation is quite a big mouthful. And so if you have any ideas, that would be really a great name for this program. Please email your suggestions to me at rdepot@nkfi.org anytime before November 30th. We'll be announcing the winner in early 2021. And if your name suggestion is chosen, you will win a $100 Visa gift card. So with that, I am going to turn it over to our speaker. So we have Samantha joining us today. She received her bachelor's degree in biochemistry in 2015 at Northeastern University in Boston. She's from Northwestern now. After college, she spent time working in clinical research in the fields of sleep medicine and obesity research. She came to Northwestern University for her PA education and graduated in 2019. Since graduation, she has been working at Northwestern Memorial Hospital in the Department of Nephrology, and most of her time is spent doing inpatient consults for a wide spectrum of acute and chronic renal illnesses on the wards and in the ICUs. She also has a once-weekly outpatient clinic where she sees CKD patients. So with that, I'll go ahead and turn it over. I just stopped my share, so it's all yours.
Thank you. Let me pull up my screen for you guys. And then, let's see. Just going to make this larger. Okay. Are you able to see that, Rachel?
It is perfect.
Okay, awesome. So thank you guys for having me today. I'm really excited to get to talk to you guys and specifically about the basics of chronic kidney disease and a little bit about healthy living with CKD. So just an overview of what we'll be talking about today. We are going to go through the basics of CKD, specifically what are the causes, the stages, how do we make the diagnosis, and generally how do we treat CKD. And then we'll move into how can we slow disease progression with our lifestyle choices, including a bit about diet options, exercise, and other healthy lifestyle choices. So let's dive into the basics of chronic kidney disease. So I think to start off, let's just define what CKD is. And so I'll be using CKD, to talk about chronic kidney disease, because otherwise it's a mouthful for this whole presentation. So CKD is a gradual loss of kidney function over time. It's generally thought to be a progressive disease. The kidney has many different functions, some of which you may be familiar with and others that might surprise you. So the kidney helps remove toxins from the body. And as people kind of progress through CKD, those toxins can build up and cause some symptoms that we'll discuss later on in the talk. The kidney also helps us produce urine, and this urine production may go down as patients progress through CKD, And sometimes we use medications such as diuretics or water pills to help increase the urine production. The kidneys are also vital to managing the fluid balance in your body, specifically salt and how it relates to the level of water in the body. And some patients, as they progress through CKD, may find that they have more issues with things like swelling in their legs or their face related to the loss of this function. The kidneys are also very important in controlling the chemical balances of the body, specifically the electrolytes. Many of you may have heard of electrolytes such as potassium or the bicarbonate level, which helps regulate very tightly those electrolytes in the body and keep the acid levels in the body in the normal range. The kidneys also play a vital role in regulating your blood pressure and keeping it within the normal range. And a function of the kidney that maybe some people aren't aware of is that it also helps with the production of red blood cells. So the kidneys release a hormone called epoetin, which helps stimulate red blood cell production in the bone marrow. Sometimes as patients get further along in CKD, we have to replace this function by giving you a medication. Usually it's a shot in the belly or through an IV, and this actually gives you the hormone that the kidneys aren't making anymore. And another thing that the kidneys do for us is actually keep your bones healthy, and the kidneys do this by activating vitamin D within the body and regulating the amount of calcium and phosphorus in the blood. And just to review the anatomy of the kidneys, so you have two kidneys and they sit towards the back of the body. They're highly vascularized organs, meaning that they have a lot of blood flow to them, and there's a lot of big and little blood vessels in the kidneys. They drain urine through, each one has a ureter, and the ureters drain into the bladder, and then urine is expelled through the urethra. So when we think about the causes of CKD, there's many out there, but far and away, the two most common causes in the United States are diabetes and hypertension or high blood pressure. Together, these two diagnoses make up about 75% of all causes of CKD, and in many circumstances, patients may have both, and it's difficult to say for certain which one is the driving force for the chronic kidney disease. There's other important causes of CKD, including glomerulonephritis, which is kind of a broad group of diseases that specifically affect the filtering units of the kidneys. Polycystic kidney disease, which is typically an inherited disease. There's other inherited genetic malformations such as solitary kidney or horseshoe kidney and other anatomic abnormalities. Lupus and other autoimmune diseases can cause chronic kidney disease. In some circumstances, obstruction from repeated kidney stones, or for some men, enlarged prostate can be the cause of CKD. And for some patients, repeated urinary tract infections or kidney infections can cause CKD. You may have heard that there's different stages of CKD, and just to go through about what those stages mean and how we put patients into a stage. So essentially, the stages of CKD are determined by how well your kidneys are functioning. So how well are they filtering blood and waste products, as well as removing extra fluid from the body. You may have heard from your doctor that we talk a lot about something called the estimated glomerular filtration rate, or eGFR. We don't measure eGFR directly in the blood, but it's actually a calculated number based on your blood creatinine level. All that creatinine is a waste product in the body that normally is filtered into the urine by the kidneys, meaning that the kidney's job when they're healthy is to get rid of extra creatinine. Therefore, in a healthy patient without any kidney disease, the creatinine level will be low. As you progress through kidney disease and the kidneys are not able to filter out the creatinine as well, the blood creatinine level will go up. The higher the blood creatinine level, the lower the GFR, which puts you into a higher stage of CKD. So they have an inverse relationship. In general, we consider an eGFR over 60% to be normal. It's really when we get to that stage 3 CKD that we start, diagnosing someone with CKD and thinking about how can we best treat it. Stage 3 is divided into 3A and 3B. Otherwise, broadly, stage 3 is 30% to 59% kidney function, or GFR. Stage 4 is 15% to 29% GFR. And stage 5 is under 15% GFR, and typically this is when we start considering other treatment options to replace the function of the kidney, such as transplant or dialysis. I want to stress that CKD is really common in the United States. It's estimated that 37 million adults, or more than 1 in 7, may have CKD. And because symptoms usually do not start showing themselves until later in the disease, 90% of patients may actually not know that they have CKD. Kidney diseases are the 9th leading cause of death in the United States, and every day more than 300 people begin treatment for kidney failure, whether that's receiving a transplant or starting dialysis. There's many risk factors we've identified for CKD, including diabetes and high blood pressure, heart disease, obesity, a family history of CKD, and older age. Demographically, we know that the risk of developing end-stage kidney disease, which you may also hear referred to as ESKD or ESRD, is 3 times higher in African Americans than in white populations, 1.3 times higher in Hispanic populations than in white populations, and there's also just a higher prevalence in Native American and Asian populations compared to white populations. We estimate that about 1 in 3 adults with diabetes may have CKD, and 1 in 5 adults with high blood pressure may have CKD. And since we know those are 2 of the most common diagnoses in the United States, things like diabetes and high blood pressure, it just goes to show you how common chronic kidney disease really is. So what are the signs and symptoms of CKD? Typically earlier on in the disease, there's really no symptoms. It's only when we get to stages 4 and 5 that patients may start to show some symptoms such as swelling in the hands and feet or puppy eyes, decreased urine production, nausea or vomiting, which can lead to weight loss, fatigue, low energy, itching, difficult concentration, or sometimes even confusion. The complications of CKD do progress with each stage and may include harder to control blood pressure, anemia, or also known as a low red blood cell count, weak bones, or nerve damage. And we know that CKD can increase your risk for things like heart disease, heart failure, stroke, and early death. So how do we make the diagnosis? So most importantly is to make the diagnosis as early as we possibly can to get the patient started on both lifestyle changes and medications that can help prevent the progression of CKD. So typically we diagnose CKD with both a urine and a blood test. The urine test screens for protein in the urine, also known as proteinuria. So basically your kidneys kind of work like a coffee filter in the sense that when they're getting rid of toxins in the urine, they're also keeping in the things that they're meant to keep in. So like your coffee filter tries to keep all the coffee grinds at the top of the coffee pot and not in your cup of coffee, your kidneys like to hold on to protein and keep it within the body. As the kidneys get damaged when they progress through CKD, you may find that there's more protein in the urine, and this is a sign that there's some kind of intrinsic damage within that kidney itself. Typically, we look for protein in the urine with a urine dipstick, or sometimes your provider may order something called an albumin to creatinine ratio. The other component of diagnosing CKD is with the blood test. So again, we want to look for the creatinine level in the blood, which is used to calculate the eGFR. Typically, you'll get this number checked frequently. Sometimes it could be as much as every few months, depending on your stage of CKD. And that's because the trend of the creatinine is really important to us to make sure that if there is some kidney damage, that it's not progressing. Other important blood levels that you may hear from your provider include the blood urea nitrogen level, or BUN, the sodium level in the blood, potassium, and the bicarbonate levels. In some cases, we use a kidney biopsy to diagnose the cause of CKD. We don't always do this in every case, and typically this is determined if it's necessary or not by your nephrologist or kidney doctor. So how do we treat CKD? Honestly, the most important part to treating CKD really is the prevention of progression of disease. And in general, the treatment of CKD will vary depending on the cause. It'll be different for someone who has CKD due to diabetes versus someone who has CKD due to lupus, but it will always include things such as the following. We want really careful blood pressure control because uncontrolled high blood pressure can lead to progression of chronic kidney disease over time. We can do this through a number of methods, including some lifestyle changes that we'll talk about, smoking cessation, weight loss, medication adherence, and maybe you'll be prescribed a medication by your doctor called an ACE inhibitor or an ARB. If you have diabetes, the control of blood sugar is really important to preserving kidney function. So keeping your A1C within your goal is going to be very important to preserving the function of your kidneys. This may entail regular visits to your PCP or your endocrinologist if you have one. It'll be very important to follow up with a nephrologist or a kidney specialist, especially if you're at that stage 3 CKD or above. And that's really because your nephrologist will know all of the best methods possible to preserve your kidney function and prevent the progression of disease. It may also be very prudent for you to meet with a dietitian, especially one who is well-versed in treating patients with chronic kidney disease, because as we'll talk about a little bit later in the talk, there's some very specific things that you may need to change about your diet depending on what's going on. And then we advise all of our patients to avoid certain what we call nephrotoxic drugs. All this means is that there are certain drugs or medications that can be directly toxic or harmful to the kidneys. So anytime that you see nephro as a part of the word, the nephro means kidney. So this may include NSAIDs or the non-steroidals, and this is your ibuprofen, Aleve, Motrin, as well as iodinated contrast dye. You may receive this when you're getting a CT scan, and certain antibiotics. And then as we progress to stages 4 and 5 in CKD, it includes preparing for transplant. And this means either determining if you have an available living donor or joining the transplant list. And then it can also mean preparing for dialysis. I just wanted to touch upon these 3 things. It's not really the bulk of the presentation, but as we progress through CKD, we have to start thinking about the ways that we have possible to replace the function of a failing kidney. Ideally, we like to get as many patients as possible towards transplant. And all this means is that a donor will give a kidney to the recipient, and this new kidney will replace the function of the failing kidneys. I know this picture shows the other kidney being thrown into the trash. Typically, that's not how it works. Your native kidneys will kind of stay where they are, and the transplant is put into the pelvis. Other options for replacing the function of the kidney include hemodialysis. This is done through the blood, usually through a fistula or a graft, or sometimes a catheter. And essentially this helps us filter out the waste products in the blood, take out extra fluid, and then return the clean blood back to the patient. You may have also heard of peritoneal dialysis, which is a version of dialysis that you can do at home, and it includes a catheter in the belly and using dialysis fluid to help filter out waste products without the use of blood. So now that we have all of our basics covered on what CKD is and what kind of symptoms you may be experiencing, let's talk about the thing we really care about, which is how can we slow disease progression? And first I want to just touch on some kidney-friendly diets to help you slow disease progression. In general, diet recommendations are going to depend on your own personal past medical history as well as the stage of CKD that you're in. I think it's really important that you ask your nephrologist to refer you to a dietitian who's well-versed in CKD diets. Early on in CKD, it's important to focus on things like heart-healthy diets, or if you have diabetes, to follow a diabetic diet. And your heart-healthy diet usually includes those that are low in saturated fats and cholesterol, and higher in healthy omega-3 fatty acids. You typically find these in things like salmon, fish, nuts, seeds. This may also include a salt restriction to about 2,000 milligrams or 2 grams per day, and this translates to less than 1 teaspoon of salt per day. And in some circumstances, this also may include fluid restrictions, but you should always check with your doctor first. And then diabetic diets typically involve carbohydrate counting to help you improve the blood sugar control and keep the A1C low. This may include avoiding sweets and things like high fructose corn syrup, and replacing your white bread with wheat bread or white rice with brown rice. Another really good diet option for kidney patients is the DASH diet, which is also known as the Dietary Approaches to Stop Hypertension. This is a really good one, especially for patients who have high blood pressure, because the DASH diet has been shown to lower blood pressure, lower the risk for heart disease, stroke, and cancer, reduce kidney stone formation, and typically this diet is rich in fruits, vegetables, low-fat dairy, whole grains, etc. And most importantly, it's low in salt and sodium, as well as added sugars, sweets, and fat, and red meat. The DASH diet has been actually shown to slow the progression of CKD and heart disease. But of course, it may not be for everyone depending on how advanced the kidney disease is, so you should always check with your provider first. So salt is a really big one for kidney patients. It's kind of in all of the food that we eat. It sneaks into a lot of processed foods that we may not realize. And it's really, really common, especially if you're getting any kind of takeout, even if it may not taste salty, there's probably a lot of salt or sodium in it. So how can we avoid salt when it's everywhere? Really, the recommendation is to make as many of your meals at home as you can, and you can try flavoring your food with more herbs and spices rather than table salt. Adding aromatic vegetables to your food. I'm a huge fan of the onion and garlic and celery combination. Adding some more flavor with citrus fruits, lemon juice. Again, avoid takeout where you can. And then especially as you get to stages 4 and 5 CKD, definitely want to let you know to beware of salt substitutes that you may find at the grocery store. And that's because they are usually just replacing the sodium with potassium. So using this in your food can lead to really high potassium levels in the blood. Another good option is a plant-based diet, and I want to make it clear this is really just about reducing your intake of meat and not necessarily becoming a vegetarian tomorrow. It's been shown that adapting to plant-based diets can slow the progression of CKD and improve some complications that we talked about before, including high blood pressure, something called metabolic acidosis, which is when you have high levels of acid in the blood, as well as correct high phosphorus levels in the blood. So it's been shown that choosing soy and vegetable protein over meat protein can reduce the risk of CKD and progression, specifically in patients who have type 2 diabetes. And it can also help you with a number of other positive things, including weight control, heart health, and then the fiber from the food can also help improve gut health. So I just want to make it clear, it's not about just completely revamping your diet and becoming a vegetarian and throwing away everything out in your kitchen, but I think just incorporating a meatless meal, you can start with once a week and work your way up, can really help you in the long run, and may also give you the opportunity to try some new foods. So I want to touch on certain aspects of a CKD diet that are specific to patients with kidney problems. So especially as we progress to stage 4 CKD, there's some other nutrients and minerals we need to very closely monitor, and potassium is a big one. So potassium is a vital mineral found in the body. It helps maintain our heartbeat, and it helps with muscle contractions. And it's found in a whole lot of foods that we typically eat in the American diet. Normally, your kidneys are excellent at tightly regulating the potassium level in the blood. But of course, as CKD progresses, the loss of kidney function makes it hard to control it so well. And this can lead to high levels of potassium in the blood, which may lead to some very dangerous cardiac complications if they get high enough. So as we progress in CKD, the importance of a low potassium diet becomes increasingly more necessary. Sometimes your nephrologist may prescribe you a medication called a potassium binder, and this actually helps you get rid of excess potassium in the stool, but it should always come back to first trying to control the potassium with the diet. So a normal American diet is about 3,500 to 4,500 milligrams of potassium per day, and a CKD diet is about half of that. Potassium's in a lot of the different foods we eat, including salt substitutes, again, orange juice and oranges, tomatoes, tomato juice, tomato sauce, bananas, potatoes, so things like mashed potatoes, baked potatoes, potato chips, beans, fish, cheese, poultry, and nuts. And I never want to tell people that they can't have any of these foods, but rather that they need to be aware of what foods that they're choosing and to eat them in moderation to prevent high levels of potassium in the blood. Another important one to talk about is a low phosphorus diet. So phosphorus is a mineral that is mostly in your bones, and it helps to form the strong bones and teeth. It creates energy in the body, and has many, many other functions within the body. Typically, it's related to calcium levels in the blood, and the kidneys will remove excess phosphorus in the urine to keep both the phosphorus level and the calcium level normal. However, in CKD, phosphorus can accumulate in the blood, and what it actually does is it starts stealing calcium from the bones, and this leads to weak bones and sometimes bone disease. High phosphorus levels can also cause calcium deposits in small and large blood vessels, and these are found all over the body, the lungs, the eyes, the heart, as well as the kidneys. So following a low phosphorus diet, again, becomes increasingly more important as CKD progresses. And probably even more common than the potassium binders are the phosphorus binders. So these may be prescribed to you by your physician or your provider. There's many different options available for this. So again, a normal American diet, 800 to 1200 milligrams of phosphorus per day, and a CKD diet is less than 800 milligrams per day. Phosphorus is present in a lot of processed foods. It's often used as an additive or a preservative. So it's common in dark colas, so your Coca-Cola and Pepsi, or other dark colas such as that root beer, beers, hot cocoa, or chocolate. Dairy products is a big one, and again, the processed foods. So I just want to quickly touch on how to understand nutrition labels, because they can be pretty confusing and they're kind of always changing. And I think important to note is that because there are certain, like the phosphorus and the potassium levels that you may need to follow on a more restricted diet, these percentage daily values are not going to be correct for you. So typically a low potassium food is less than 100 milligrams or less than 3% of the daily value. But again, their daily value is based on a potassium intake of 3,500 milligrams a day, whereas a kidney diet is less than 2,000 milligrams per day. So the daily value is not going to be correct for someone who's following a more restricted diet. The phosphorus, those values are listed in the bottom right too. And again, this is for 1,000 milligrams of phosphorus a day, and we're aiming for less than 800 milligrams of phosphorus a day. Potassium and phosphorus may not always be listed in the nutritional label, so you should always check the ingredients, and they may kind of come up in different names, such as potassium chloride, potassium citrate, potassium iodide, or magnesium phosphate, calcium phosphate. A nice trick is to add a 0 to the percent phosphate that you may see here in the bottom right of the nutritional label. And this will give you a rough estimate of the milligrams of phosphate. So in this case, it would be, it says phosphorus 8% of the daily value, so it would be 80 milligrams of phosphorus in this item. And then another really important one to look at is just the serving size. You know, they give their suggested serving size, and all of these nutritional facts are based off of that serving size. But if, you know, if there's 20 servings per container, like it says here, if you were to consume half the container, then you'd have to multiply this by 10, and then you'd be at your 800 milligrams of phosphorus for the day. So now that we've talked a little bit about diet, let's move on to slowing disease progression with exercise and how important it is to incorporate exercise into your routine. Exercise has numerous benefits for patients with CKD, can increase your physical fitness, of course, and improve muscle strength, prevent muscle wasting, which can become a problem for patients as they kind of progress through CKD, improve your cardiovascular health, better manage your blood pressure, help reduce cholesterol and chronic inflammation in the body, may give you better sleep quality, and decrease things like anxiety, stress, and depression. So what will exercise do for me specifically as a kidney patient? Let's take a look at the studies. So in 2014, a study looked at over 6,000 patients who had CKD stages 3, 4, and 5, and compared the overall mortality, which just means the overall chance of dying, and the risk of needing dialysis in groups that participated in exercise versus groups that did not exercise. And what they found was really amazing, and it's that at the same level of kidney function, patients who walk for exercise had a 30% decreased risk of dying and a 21% decreased risk of needing dialysis compared to their counterparts who did not exercise at all. And this benefit actually increased when patients walked for more days per week, as well as for longer periods of time, meaning that the more that you exercise, the better improvement you'll have in your risk of needing dialysis or risk of death. And very importantly, this benefit's unrelated to what stage of CKD the patient's in, meaning that the patient who is in stage 3 had the same benefit as the patient in stage 5. And it was also regardless of age. So whether you're young or old, you'll both get a benefit from incorporating exercise into your routine. And this study looked at a variety of different exercise routines, including walking, hiking, running, swimming, biking, and even just with simple walking, you can really reap the benefits. So how much exercise is enough? It's recommended that you do and work your way up to 30 minutes of walking 5 times a week. Of course, if you're currently sedentary and you're not exercising at all, you don't want to start with this right off the bat. You want to kind of work your way up slowly in terms of how frequently you're doing as well as for the duration. And then once you feel good with that, you can consider adding on 2 sessions a week of strength building exercises, concentrating on low weight, high repetition exercises. Add in light stretching as a warm up or cool down. And then important to know the warning signs to stop exercising, especially if you're incorporating something new into your routine. But if you're experiencing things like chest pain, shortness of breath, feeling like your heart is racing, or feeling faint or dizzy, you should definitely sit down, talk to your provider before you start a new exercise routine. So then I just want to move into our last portion of the talk, which is just going to be kind of a hodgepodge of different healthy lifestyle choices that I think are important for patients who have chronic kidney disease to help slow their disease progression. So a big one for most chronic diseases, but especially CKD, is maintaining a healthy weight. We know that obesity increases the risk of multiple chronic health problems. And actually, it's been linked to certain forms of CKD and kidney failure, in the sense that we think that a person may have kidney failure directly due to their obesity. In general, a higher body weight just puts higher demand on the body as well as the kidneys. And for patients who are overweight, and that's defined as a BMI over 25, just a 5 to 10 pound weight loss has been shown to decrease the blood pressure by about 5 points, which could mean the difference between having to start another medication or not. Weight loss can also help you better control diabetes. And of course, the healthy weight depends on your height and gender and activity levels. And if you're not sure if you're at a healthy weight, you should ask your provider before starting a weight loss plan. Another really important one is smoking cessation, or even just reducing how much tobacco smoking you're doing. We know that smoking tobacco is harmful to many organs in the body, and the kidneys are not spared by this. Smoking tobacco can increase high blood pressure. It actually can reduce blood flow to the kidneys and damage the blood vessels within the kidneys. Smokers have a higher risk of proteinuria, or protein in the urine. It can increase the risk of CKD in patients who already have diabetes or high blood pressure. So it's kind of a double whammy when you're already have those problems and then add smoking on top of it. We know that smoking can lead to cancers in the lung, but actually it can also lead to cancers in the kidneys. It can contribute to heart disease risk and increase your risk of stroke. In general, we like to promote smoking cessation, meaning that you stop smoking altogether. Of course, this can be really difficult if you know anyone or you yourself have tried to quit smoking, and it can take a couple of tries. So even if you can cut back on how much smoking you're doing, you'll likely see a benefit for your overall health. Another one is to minimize alcohol use. So I think it's important to kind of establish what is considered excessive alcohol use. And we define this as either 4 drinks in a day, or 7 drinks across a week for women, or 14 drinks a week for men. And it's because this has been linked to some dangerous health effects. And to define what a drink is, it's 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. We know that regular heavy drinking actually doubles the risk of CKD. And if you add this on top of smoking tobacco, this can increase your risk by 5 times for CKD. Regular alcohol use actually puts stress on the kidneys and can disrupt some hormones in the body related to the kidneys. And it's been linked to high blood pressure at just 2 drinks per day. You should always have special caution of alcohol use if you have any history of liver disease. And if you feel like you're in need of assistance of cutting back, you should talk to your provider for some supportive options that are available. Another one that I want to touch upon is just how important it is to avoid illicit drugs when you have kidney disease. Because many street drugs have been shown to be directly toxic or harmful to the kidneys, including heroin, cocaine, and amphetamines. Sometimes these drugs can raise your blood pressure very fast and can lead to severe cardiovascular events, strokes, or heart attacks. Drug use has been shown to have a 25% higher chance of CKD progression and 41% chance of early death compared to patients who do not use drugs and also have CKD. And then lastly, before we finish up, I just want to talk about avoiding some over-the-counter medications. And I think if you ever have a question, you're never in the wrong to ask your provider first if this is safe to use and is it safe for my kidneys. So the most common ones that you'll be counseled again and again to avoid by your providers are the NSAIDs or the non-steroidal anti-inflammatory drugs. Some brand and generic names of these include ibuprofen, Aleve, Motrin, Advil, naproxen. You might read online that aspirin is also an NSAID. Lots of people are recommended to take a baby aspirin, and this has not been shown to be harmful to the kidneys. So if you take a baby aspirin for other reasons, you should keep taking that. It's not going to cause harm to your kidneys. Herbal supplements is a really big one that I encourage kidney patients to stay away from. The reason for that is that certain herbal supplements and over the counter, even some vitamins, they're not FDA approved or regulated, meaning that whatever is listed on the bottle may not necessarily be what's in the pill. And sometimes these herbal supplements, whether it's the additives that are put in them or the supplement itself, might have really high levels of things like potassium, despite it not being listed in the label. So in general, I recommend to avoid herbal supplements. I have licorice root listed here, which has really, really high levels of potassium in it, actually. And kidney cleansers, things such as this, I encourage patients to avoid as well. Another important one are laxatives that contain phosphate. These are also known as fleet enemas. They have really high levels of phosphate in them, and kidney patients should not use them because it can cause dangerous levels of phosphorus in the blood. And then some upset stomach medicines, such as milk of magnesia, which has high levels of magnesium in it, and it can cause toxicity in some patients with kidney disease, as well as Alka-Seltzer, which actually is an antacid that has sodium bicarbonate in it. Some of you may be prescribed sodium bicarbonate by your provider, and this is something that we like to more tightly control to make sure that the acid levels in the blood are good. So in general, I would also advise to avoid Alka-Seltzer. So with that, that's my presentation for today. I hope that you guys gleaned some helpful information from that, and I'm happy to take any questions that you may have.
Thank you so much. So I think that the first question I had was, for somebody who may be obese and have have diabetes, and doesn't really have a nutrition plan or an exercise plan, do you have any recommendations for starting points for that type of a person, where they can potentially start to take a little more ownership of their health?
I think that's, a great question. I definitely think, if you have chronic medical problems and you're starting a new exercise routine for the first time, it's always good just to check with your provider first. It could be your primary care provider, or if you see a nephrologist or a diabetes specialist, I think it's important just to check with them first. But I really think it's important to just start gradually. You don't need to be coming off the couch and running a 5K tomorrow. I think it's really just about building up to things slowly. So whether that's, starting with, a 5-minute walk one day and building up to a 10-minute walk a couple days later. Maybe you want to add in some running and you run 1 minute and then you walk for 5 minutes, and then kind of increase the running portion and decrease the walking portion just gradually over time, and just making sure that you're staying hydrated while you're doing it. Paying close attention to those warning signs we talked about. If you're getting chest pain or chest pressure or feeling, short of breath. Sometimes you feel short of breath when you exercise, but more than you expect to, or you're feeling faint. Those are reasons why you should scale back, relax, take a deep breath, and check with your provider before you start. I think the other important thing for some patients is, especially for patients who are looking to lose weight, is kind of taking an assessment of what you're actually eating every day. And it can be surprising if you're like a lot of us who are just really busy throughout the day and, maybe mindlessly snacking, or, don't have time to prepare a healthy lunch. And so you grab takeout, and we're not always sure, how many calories we're eating from this takeout and whatnot, or, if you're working in an office right now, which I know a lot of us aren't, but when people bring in donuts, surprisingly, and you weren't accounting for that. So I actually really recommend to a lot of my patients to download a calorie counter app. I really like the MyFitnessPal app. I know a lot of people use it. And if you can just, for a day or two, record what you're eating without, trying to make any changes per se, but actually just kind of take inventory of what you're eating. And that'll kind of help you identify some patterns of, where can I cut out calories that I'm not going to miss? So things like sodas, which are kind of the empty calories, and other kind of mindless calories. And I think that's a good place to really start taking ownership, is to kind of take tabulations of where you're at in the moment. And then you can kind of start making some smart decisions from there.
That's great. Thank you. Another question is, I feel like I started having chronic kidney disease because I was prescribed to take too many nonsteroidal anti-inflammatories. Can that cause chronic kidney disease, taking too many NSAIDs, or can that damage the kidneys?
In some circumstances, it can actually. There's other, a lot of people take NSAIDs for a lot of really good reasons. Our colleagues who work in things like orthopedics or rheumatology frequently prescribe NSAIDs for a variety of different inflammatory diseases. They're anti-inflammatory drugs. Some patients may just be more susceptible to kidney damage from these drugs, unfortunately, especially if you're taking them for prolonged periods of time, if you're taking them when you're otherwise, if you're having an illness where you're dehydrated. Essentially all the NSAIDs do, they can do a lot of different things in the kidneys, sometimes damage actually within the kidneys itself, or sometimes it actually just kind of reduces the blood flow to the kidneys. So if you're taking NSAIDs and then there's some other kind of other health problem going on as another insult to the kidneys, it can kind of lead to this perfect storm. And so, long story short, yes, it is possible to actually develop chronic kidney disease from NSAID use. And that's why anyone who has, either a history of having what we call acute kidney injury from NSAID use, we recommend that they avoid them. And especially in our patients who then have chronic kidney disease, we always avoid NSAIDs unless there's a really, really good reason to take them. But typically we just say go for Tylenol instead for pain.
That's great. Thank you so much. I've given another minute or so in case any other questions come in, but just wanted to see if you had any final words or parting thoughts for our audience today.
Yeah, I think, again, chronic kidney disease is so exceedingly common. I think the hardest thing is actually, getting the diagnosis made. And that's because typically, like I said before, patients might not have symptoms. So I think, if you're looped into a nephrologist, you want to stay with them, develop a good relationship with them, really just try everything that we can to prevent disease progression. In certain circumstances, it depends on the cause of CKD, and sometimes you do have kind of improvement in the kidney function, but in most cases it is kind of a progressive disease, but that's not to say that it has to progress. I think, it's good to remain hopeful and to just really concentrate on the things that you can do and work with your provider to kind of figure out the best way to, if you have decreased kidney function, to keep it where it is rather than let it get worse over time. And especially, if you're the first person in your family that's been diagnosed with chronic kidney disease, to, let your family know that, if you're comfortable that you've been diagnosed with this, and kind of let them know so that they can also, be screened by their providers so that we can make more diagnosis early and kind of get people looped in early. Because I think that's really the key to combating this disease.
Thank you so much for your presentation today, and thank you for everyone for joining us. I hope everyone has a great rest of your day.
Yeah, thank you guys. Have a good day.
Bye.
Happy Thanksgiving.